Good evening and welcome to Co-Ed for Kids Facebook Live. I'd like to thank you for joining us today, whether you're watching live or the replay, and I want to make sure you listen closely as we have so many ideas to help families when they're not sure where to go when they need some help and supports. I'd like to mention today's topic is on concrete supports. It's one of our protective factors. They're all critical, but this one really takes consideration families that just might need some help, regardless of whether it's a loss of a job, or you might need help with the heating bill one time, or where do you go to find services to help find preschool or childcare for your little ones. I think also some of this, what I just went through the last 3 days with some friends in my community, they're going to need a lot of concrete supports because of a death in the family, and but whoever needs to surround them to support them, whether it's agencies or other family and friend members. My name is Melissa Shamel. I'm the Special Projects Coordinator for Co-Ed for Kids Prevention Services. I'm here with Ann Brandt to discuss protective factors, the concrete support in times of need. Briefly, concrete supports is, again, where family needs to go to get resources and even basic needs when they need it. Finding this support and help kind of reduces the stress level in families so they can more go on with things less challenging in their lives and reduce any tension and stress that might be happening in their families. I have invited Ann here to give us a lot of ideas and ways to seek out those resources to meet our needs. Ann is a professional clinical counselor supervisor who works with children and families in the areas of mental health and chemical addiction. With her extensive background in helping families, I knew she'd have plenty of information to share with us about finding concrete supports. So I'll let Ann take it at this point, and we'll talk a little bit about defining what specific concrete supports can be in our communities, and what does it mean, how does it impact our families. And this is Mental Health Month, Mental Health Awareness Month. So I think this is another good time to bring this into play and as a topic.
Right.
Thanks, Ann, for being here.
Sure, no problem. I think one of the things that I think throughout my career, what I've noticed is that even when I'm just fielding general phone calls from the office, is that I'll have someone call me and say, I don't know what I'm asking for, but I'm going to ask it anyway, and I don't know if this is the right place or not, but maybe you can help me. And I think that's when we're whether it's in a crisis situation or whether we really feel the need to get supports. I think one of the things is being able to know what really the problem is. And I think that's the first jumping off part about getting a concrete support, is knowing what you're looking for.
So the families need to really communicate as specific as they can what help they need in what areas.
Correct. And one of the difficult pieces is that something can be as complex as it can be 2 or 3 or 4 things, rather than what you thought was just one problem. It's kind of like an onion. It will peel open to having a lot of different types of layers that you weren't expecting. So the things that we look at is, one, trying to really figure out what is the problem, what support do you need, and if it turns out that you need multiple supports, that's fine, but where's the best jumping off point? So again, it's looking at, one of the things that we always look at in terms of is your immediate supports, and that's your family, your friends, your extended family, people that you may have relationships in work or in church. And those individuals can provide you information in terms of, they can provide you support, they may have ideas, they may know people and have other connections. So sometimes a grassroots effort is really a nice way of feeling safe about getting the support. Sometimes when there's a mental health issue, or sometimes if there's a physiological issue and we're not sure what to do, sometimes it's easier to approach a family member or someone you really trust versus having to call an agency or talk to someone that you're not quite sure that you aren't real comfortable with. So that grassroots effort is one really good approach to finding out concrete information. People have ideas, people have contacts, people know other people. So the second thing is that if we've done that, we've been able to define the problem and we've maybe tried to do the grassroots approach. The next thing is that, do you know your community? And it's looking at what in the community do you know? A lot of us sometimes don't realize what our community offers us. We know it has the basics. We have, police, fire, ambulatory, we have hospitals, we have doctor's offices, things like that. But sometimes the problem is very specific and sometimes it's very complex that those general supports aren't going to help us. So where do we go for those things? Again, sometimes it's in small communities, it's your municipal building. In some communities, it's your mental health board or your substance abuse prevention board that would have information. Sometimes you can talk to your physician, your pediatrician. They have a lot of different referral sources, whether it's for food or for transportation, child care, mental health, substance abuse services. I, as a professional, always work with the physicians, hospitals, and other support systems like the police and fire department. We always work with them that if they do have someone who needs help in that area, we're able to, give a pamphlet, give a card, and they can pass that information on to people. So again, it's looking at your community and looking at who you feel comfortable turning to. Again, at times, I always recommend talk to your physician, talk to your pediatrician. Those folks have a wealth of information in terms of supports, especially for children. Your pediatrician always has wonderful wraparound services, whether it's for education, whether it's for case management supports, whether it's for back to school supplies. And that's another really great place to start looking is that our schools are becoming more and more of a support system for us in so many ways. So it's also looking at when you go into a school, look at the bulletin board and see what's on the bulletin board. If anybody has a kiddo like mine, it's going through the book bag and finding out what are those flyers and pamphlets that, your kid kind of just shoves in there because that's what kids do. That's what they do. But it's looking at those pieces too. Some schools have newsletters that they bring home every week. You can find information there. A lot of schools are doing that more and more in terms of finding, like I said, if there's mental health services, if there's different community action agencies, things like that. Another good community support is your church. Look again at your bulletin board. Look at your bulletin when you leave church. There are lots of different types of information about medical services, support services for children. It's looking at if they have a food pantry or if they have a conjugal meal or a community meal. Yeah. They'll have those. It's looking at, where do you go to look for services that are just part of your everyday. And sometimes we don't pay attention to that.
Right. I would have never thought about a doctor's office for finding supports.
Right, exactly. And that's one of the best places to go. Mm-hmm. And again, it's in the confidence of your doctor. You don't have to, when you're in with your doctor, you can have a conversation that's private. So again, the whole idea is that we want to promote people to go out and ask for help. Look for those services. Don't be intimidated. Don't feel like, maybe this is not a big deal. If you need something and your child needs something, then we've got to take care of it. And sometimes you're right. Sometimes it can feel like a huge mountain that you're approaching. But if you look at just some of the simple places that you go to, even the supermarket, if you go to the supermarket, there is informational flyers on bulletin boards, outside and around in the parking lot, things like that. We just have to start becoming more aware of our community and what our community provides.
And we're at the library in Steubenville, Ohio right now.
Yes,
so I'm sure there's other,
libraries are really great places for support.
And I picked up a two-sided little cardstock with, I think Belmont Harrison shares these services, and it's just a one line phone number and agency if you know specifically what you need.
Correct.
But as you mentioned, figuring out what you want to start with, what questions you need to ask so in your programs.
And I would encourage some of my parents that if they need to, even just writing down a couple of questions on a sticky note, and when they're making phone calls, because I understand that sometimes even making a phone call to an agency can feel pretty intimidating. So one of the things that, like I said, I like to do is that ask specific questions, write down specifically what you need, whether it's an evaluation for, for special classes at school, whether it's about, pardon me, childcare. I need childcare on the weekend. Who could I contact for that? Where can I find childcare while I'm at work? Sometimes it's a financial issue and I'm looking for a place that has flexible hours that I could work and also take care of my children. We have lots and lots of different things that we could be asking questions about. Again, the library is a really great place too. That can provide lots of information, lots of resources for us too. So that's another, again, good community place. And I think then the next step is going to the agencies themselves. That's your mental health board, your substance abuse prevention board, which are usually one and the same. But those places that they can direct you for different types of services. Your mental health facilities, whether you have just a general mental health facility or if there are private practices in your area that you can contact. Sometimes finding supports are as easy as just getting on your phone. One of our favorite activities that we do is we get on our phone if we don't know something and we ask Siri a question. And I know that sounds silly, but we have a lot of folks that have phones. And sometimes if I don't feel like making a call, maybe I need to look it up on the internet first. And so I can ask Siri, hey Siri, where do I find weekend childcare in my area? And Siri can pop up some information about that.
That's true.
You can ask Siri, I need an autism evaluation. Where would I go and find that in my area? And Siri can give you some ideas and can lead you to phone numbers, can lead you to websites where you can read and become more educated. And that's how we start to reach out to get more concrete supports.
And I think we need to be persistent at times. Agencies are out there to help us, but we just might have to jump through the hoops and listen to that phone and what extension do you push next and what number do you, because we don't know who to ask for always. But I like some of the things that you've talked about that help us get more direct help and where to go, and don't be intimidated and don't be afraid to ask those questions, because that's what we're here for, is to help our families get resources and what they need. But Siri is pretty faithful too.
She's pretty faithful. She's pretty good at what she does. So, and I think that's one of the big things is that I've done it myself, where in my life I have needed help or I've needed some kind of a support, and it's having that phone call and having a secretary not know what you're talking about. And then they put you on hold, and then they give you to another person, and that person doesn't know what you're talking about, but they may know somebody who does. So you're right. It's kind of like being it's like kind of leapfrogging over and over and over the on holds.
Yeah.
So that you're able to, finally get to maybe somebody who might know what the heck's going on.
Yeah.
So what I encourage people to do at that point is just to continue to leapfrog, take down phone numbers, and just keep leapfrogging till you get to the polling pad you need to be on. So,
and that's well put, because and don't give up, and most people are kind and helpful.
Absolutely.
And they know what you need. And I know in COAD, any of our offices, if we don't have answers, we'll find you answers, or we'll make that connection for you to where to get your answers and your help and support. And it's interesting because all of our families need some help, or they need to reach out. And I we live in a small community and thought I knew where everything was and where but then there was a situation that arose and a friend of mine, and it was decided that I didn't really know where to turn to at first and how to, well, let's start here. We did Job Family Services. That's where we worked through first, but it just depends on the situation and what the case is, but there's always places to go to get some help.
And again, different communities have different points. I mean, sometimes it's Jobs and Family, the Department of Jobs and Family Services. Sometimes it's the 648 board or the Adams board, as some places call them. I mean, every little community has its own place, but there are some basic jumping off points where you can try and make contact with folks.
And I like that point. Just make sure if you have questions or comments, or you want to know specific agencies, feel free to leave them on our Facebook comments tonight or today, whenever you're watching, because we'll definitely be able to help get back with you and find a resource that you may need. But it doesn't matter who you are, where you're from, and what your need is. There are plenty of, and that's what we are here for. We're here for you. We work for you folks. And I think Ann touched next part. I was going to ask a little bit about with substance abuse and addiction issues. And there's support groups. When you said about the churches, there's a lot of times support groups, whether it's AA or NA or Al-Anons. There's many places to go when you may not want a professional, but you want somebody that can relate to your problems or to your concerns. And
many mental health agencies will have, sometimes they'll have support groups, especially for children, like Alateen,
yes.
which is for children, or it's just for adolescents who have parents who are chemically addicted. There are some new programs coming out now for grandparents who are raising children of addiction, especially opiate addiction. That's a huge issue here, at least in Jefferson County for us. Is that we have a lot of grandparents who are trying to find support. Some of the other things, though, that, like I said, is that even a hospital may have contact information for groups. Some hospitals also have support groups, especially if it's perhaps for a child who has a specific physical disorder, cancer or diabetes or some kind of illness. Physically, they'll have support groups for parents and for children. Sometimes, like I said, different churches, AA, NA is good as well, but we also have other types of, we can have anxiety groups, we can have bereavement groups, and a lot of those come from a lot of churches, especially if there's children that are going through bereavement. They may have a children's group to support them that way. So, right, it's looking at, what are some of the mental health and drug and alcohol supports that we can have. Some agencies, especially the bigger agencies, along with counseling and seeing a psychiatrist, will also have something called case management. And case management are case managers are folks that are there to help the family get back on its feet, help them to problem solve, find them supports, and provide just overall wraparound care, just so that the family doesn't feel like everything stops after that 1 hour meeting with their counselor. Those are good concrete supports as well. We have something else in substance abuse. We have recovery peer supports. Those are individuals that are kind of like recovery coaches. They help folks to stay clean and sober. They do. They're more intense and are used more often than sometimes a sponsor. They have training in the actual treatment of chemical addiction, so they're able to provide strategies. They're able to help them to think about their addictive behavior in different ways. So you also have, peer recovery support coaches that can help well in substance abuse.
And the peer recovery, those are folks who have gone through addiction themselves. Correct. So they can truly relate to somewhat the issues that an individual or families may be encountering. And I, as a teacher, I saw a lot of youth coming through the education system that we wanted to help them and support them because some of their outward behaviors were basically a reflection from what they were going through in the home. And with just a little bit of support for the parents, it would help, the child be able to be a little more successful in school and
Right.
have confidence.
There's also a really nice piece that a lot of schools engage in, and that's prevention. And prevention is a great support. It's mostly for drug and alcohol, although drug and alcohol is now including mental health, and they go from anywhere from kindergarten all the way up to 12th grade. And they do different types of drug and alcohol education. They do bullying. They do different types of problem-solving groups with all different ages. They have a mentoring program for the adolescents and sort of the preteens, where kids help each other out. But a lot of the bullying programs are coming from prevention now. So all of those are really great concrete supports, especially if, again, there are multiple issues, maybe with a child who is shy, who may have chemically addicted parents, but also feels like they're being bullied. And, maybe mental health services aren't readily available to them. It might be too far. We now have mental health counselors in the schools, which is another great piece, is that we have folks who will, go in and do interventions with kids. And again, that information all comes from your school.
And we even had, one of my previous guests, Karen, talked about the parenting classes that they do that help with that as well. And so it just needs to be known there's support out there, and don't be afraid to ask, and don't feel intimidated to go up to somebody or attend support groups. Because sometimes I think support groups, it's a privilege to be able to have that, hour of sharing, and wow, I'm not alone in the world with some of these issues, and what I thought was kind of silly to be concerned about, other people are too. So that sounds great. I think we had a lot of tips today from Ann, and I will pick up next week on the 28th. We'll continue with a little bit more, taking the concrete supports over to the social connections and helping our families make those connections in their communities, whether it's with just other families through churches or organizations. So I want to thank Ann today for being here with me, and I'm looking forward to next week, May 28th, same time, 4:45. COAD is a child care resource agency for 31 counties in Eastern Ohio. This broadcast is brought to you today in partnership with the Ohio Children's Trust Fund and the Eastern Ohio Regional Prevention Council. Their mission is to prevent child abuse and neglect through investing in strong communities, healthy families, and safe children. The Eastern region consists of the following 10 counties: Belmont, Carroll, Coshocton, Guernsey, Harrison, Jefferson, Monroe, Muskingum, Noble, and Tuscarawas. Again, thanks for joining us. Thanks for being here, Ann. Leave comments, questions, concerns in our comment section of Facebook Live. We have YouTube channel, COAD for Kids. Our videos and other information is passed on to YouTube for Kids, or YouTube channel, COAD for Kids. And you have a good evening, and thank you for joining us.